are psychotropic medications?
So psychotropic medications are medications that can help individuals with a variety of different things. If an individual is having difficulties with their mood or worries, anxiety, or their focus or attention, or even at times where they might be hearing things or seeing things that aren't really there or feeling very paranoid, we can utilize psychotropic medications to be able to target some of those symptoms and make them feel better. Let's explore this further. And so what that would really look like is just, once again, like going to your pediatrician, but we would do a comprehensive assessment. So we would really look at, well, what is going on, especially at home, school, and with their peer interactions, because those are really the global levels that we're looking at as far as functioning with their child and adolescent. So we review all of that. We look at school history, look at medical history, we look at developmental history, we look at family history, social history, all these things, and we do a comprehensive mental status exam. And then we're working with both the child and the parents. We need all of them there for us to integrate this information. What's going on with the child, and those symptoms falling in a depression bucket, anxiety bucket, attention and focus bucket, and then how would we then target the treatment plan? And sometimes medications are necessary and sometimes they're not, but that comprehensive assessment is essential. When a child might be feeling sad or down, actually more commonly when someone is feeling sad or down, a lot of times we see anger and irritability, worries or nervousness, and or at times even some of our kids might be experiencing psychotic symptoms where they might be hearing things or seeing things that aren't really there or feeling paranoid. At times we do consider medications to be able to target those symptoms. As a child and adolescent psychiatrist, the first route is not medications. It's actually looking at all these alternative supports. So one, I'm a huge supporter of therapy. And really, frankly, medications should be utilized in combination with therapy. Only when we're in a place where either the child just needs a maintenance dose, and or the symptomatology is so severe that we need to start medication so they can even access therapy, then we go with medication alone. But really, individual therapy is extremely helpful. At times when we have a child that might be, struggling in school, sometimes it's just a meeting with the school to look at how can we better support this child in school and decrease barriers to learning. And that might be additional resources in the school, pulling the child out, having a little bit more individualized instruction, more supports in the school. So all these things need to be looked at before first jumping to medication.